I'm sure Dr. Ashok, who is the greatest professional among the professionals here, needs no introduction. But for formality, I just introduce him as follows. Dr. Ashok is an internationally acclaimed clinician with over 3 decades of experience in diabetology. Currently, he is consultant endocrinologist PIMS, Puducherry, and formerly the head department of endocrinology at the prestigious JPEF Pondicherry. And he is the academic dean of Mahatma Gandhi Medical College Hospital, Puducherry. He has authored more than 80 publications and held positions in RSSDA APA, and he is the national convener for the Indian National Consensus Group for Development of Insulin-like Guidelines in India.
Thank you, Dasa. Esteemed chairpersons and dear friends, I am overwhelmed by the love and the affection that has been shown. Jyoti, thank you very, very much. It is not a great presentation, but I call it most important presentation. I personally chose it. I was in the program committee, so Jyoti gave me the choice. Now, why this presentation? If anything going to make a difference in the way we look at diabetes, if we really want to defeat diabetes, control diabetes, if you want to not only control diabetes, we have to also control the other myriads of non-communicable disease. Because diabetes is a disease of comorbidity and multimorbidity. And this co and multimorbidity arises because of the myriads of NCDs. So we just discussed very briefly how do we tame these NCDs. Dear friends, I must tell you that what I have brought in this presentation of 20 minutes, I will not exceed 1 minute more. What is the burden of non-communicable disease in our country? Based on our own data published on the June 7, 2023. Why we changed the name from National Control Program for Diabetes, CVD and Stroke to NCD, National Program for Control of NCD. Why the name change was done? We have got many NCDs. Like we have got oncology, cancers, galore, 20%. But we will be discussing today mostly the metabolic NCD map of India, to which diabetes belongs, to which many of you, maybe all of you practice metabolic NCDs. And of course, discuss the metabolic risk factors and the NCD control. Dear friends, I am discussing regarding various initiatives, the Healthy India Alliance that we have launched. I'll give you an NCD roadmap. There are UN Sustainable Development Goals, which are very important, and 3.4 refers to NCD. And we have promised to World Health Assembly, I was present, that in 2030, we'll bring down the premature death because of NCD by 30%. Now people ask me in India when I came back, it is UN Sustainable Development Goal. Don't put gap, say unsustainable goal. But dear friends, I'll show you how the UN Sustainable Goal we can achieve. And where does NCD stand today? And I'll end with a short project that we have done with WPF assistance on controlling NCDs, which was about 6 years back, which was completed year before last. I'll just allude to that, all this in next 17 minutes. Now, if you take NCDs, today NCDs are the presiding deity of morbidity and mortality in our country. 74% of the death worldwide and 63% of the deaths in India from some monomarriage is because of NCDs. Dear friends, that includes heart disease, stroke, cancer, chronic respiratory disease and diabetes. Now this, I have already told about the SDG 3.4. Now, no, it is responsible for about almost 50 million deaths in the world. Now the top 4 mortality is because of the CVD, 18 million, cancers almost 10 million, chronic respiratory disease about 4 million, and diabetes is built in many of the diseases, so number come 2 million. And I told you about India, it's about 3%, 63% of all death because of NCDs. Now, what are the metabolic risk factors that drive this disease? 3 things: raised blood pressure, overweight and obesity, and insulin resistance. So obesity, IR and raised blood pressure drive the entire NCDs, metabolic NCDs in our country, and accompanied by hyperglycemia and hyperlipidemia. This cartoon shows that the way that we can control NCDs, I'll come back to the minute. This also shows that if you look at the global, we have coined a term called syndemic. What is syndemic? It's the combination of NCDs with diseases which are alone, like the obesity and IR, combined together we call it syndemic. It is the greatest proportion today. Now this is our own data which was published in the June 7th, and you will find, to make a long story short, we found that today diabetes is only about 101 millions. Pre-diabetes is longer than that, 136 millions. This glycemia together is 236 million. But look at the hypertension, 315 millions. Obesity, we thought obesity is much less, but you will find obesity, general obesity is about 254 millions. And look at the adult obesity, 351 millions. And with dyslipidemia, take only hypercholesterolemia, about 213 million. And high LDL alone is 186 million. So dear friends, this is depicted in the map here, that we have overall and area-wise weighted prevalence of the hypercholesterolemia. This is our study, ICE-DINDAP study, which Mohan published last year. Now the study is complete, and as we discussed yesterday in the inauguration, the Kerala has given great data for this study. Now the weighted prevalence of various lipids and the weighted prevalence of obesity, I must want to tell you that this is almost pan-India. Now what is the interpretation of this ICMR India metabolic map of India? Now this shows that if you want to win over diabetes, we have to win over the entire metabolic NCDs. I'll put number 1. Now, to reduce the premature NCD mortality by 25%, we launched the Healthy India Alliance for preventing and controlling NCDs. It has many components. One component which is most attractive is called Hriday. Hindi means heart. Health-related information dissemination. It was only dissemination of the health-related information amongst the youth. Mohan and I knows about this project. It was mostly addressed to youth. And we had a national NCD monitoring framework, and you will see that it includes almost everything. Premature mortality to reduce by 25 to 30%. Essential medicines, NCD drugs and technologies must cover 80% of the population. Drug therapy and counseling 50% of the population. Household air pollution like indoor cooking and all that, 50% reduction. Diabetes, obesity may not reduce, but 0% rise. It should not rise further. Raised blood pressure, 25% reduction. Tobacco use, 30% reduction. Salt intake, 30% reduction. Physical activity, we aim only at 10% initiated. And this was the framework on which we tried to run this project. And believe me, dear friends, these are very small advances, 30% tobacco smoking reduction. But you will find that we made this goal, to make a long story short, in only 50%. That means we could not even achieve that. But be that as it may, this is a step to tame NCDs, and some effort has been made to control at least 50% of the reduced objective. Why we should join the Healthy India Alliance? To build partnership for a collective response to NCD. Without partnership, the NCD cannot be tamed. Now, in the Healthy India Alliance, we have got about 12 C's. We talking about converge, we talk about collaboration, we talk about care and connect. We believe in capacity building. I'll show you what we have done in our project. We compute, we catalyze multi-sectoral advocacy, very important. I'm very happy Mohan is here to chair this session because he is the leader of the NCDs in the state. the catalyze secular advocacy, and to contribute. So these are the things that we get the clarion call. What is the NCD roadmap? The NCD roadmap, to again make very brief, we wanted to achieve all this by 2025, which is only 1 year away. When we met 2 years back in the World Health Assembly, we confessed that India cannot achieve this by 2025. So am I correct, Mohan sir? So we said 2030 will achieve something. So that is the roadmap I am going before you. So the roadmap identifies the several barriers at the country level to achieve this NCD Global Action Plan target and the Sustainable Development Goal 3.4 and 3.8. And the entire SDG 3.4, 3.8 is centered around NCD. Can you believe that the entire development of the country is centered around NCDs? It is also the national income. It's also centered around well-being. Well-being, which comes out of NCD control, is one of the very important facets of NCD roadmap. So both the control and the well-being. Dear friends, there are many. We call it JPEF, Global Monitoring Framework. We can monitor the impact indicator like the premature mortality. We can discuss the performance indicator like how many of us are physically active, how many of us are blood pressure control has been achieved. We have got progress indicators. We have technical packages, plans, and also we have many WHO best buys. It's not possible to speak all about in this meeting, but I'll pass on a small document which we have brought out for the NCD control in our country, which deals with all this. Now, what is the agenda for the SDG 2030? Now, the agenda, to make a long story short, is to reduce NCD mortality at least 1/3, and there are so many indicator framework. Now, dear friends, about the implementation framework, we have extended this from 70 to World Health Assembly to 2030 to reduce NCD mortality, to change insufficient physical activity, and change harmful use of alcohol. Other things I already told before. Now there are many data sources from which these indicators are found out, but what is most important is the public health surveillance and the public health function. Now there are many gaps like at the population and healthcare facility level. Now tackling the indicators, we have to measure. We have to measure the indicators to control it. And one of the objectives of this NCD roadmap was to bring out guidelines. Every country should have a guideline. So we have a diabetes control guideline. We also have a hypertension control guideline which has been used by the HSI. I'm sure the media I don't know details of it. Last part, that why we changed the name from NCPDCS to NPNCD, we realized that many diseases which are NCD were not included, like kidney disease, like NAFLD, non-alcoholic fatty liver disease. So many of the diseases which were not included, therefore we said not only diabetes, hypertension, stroke and CVD, we included all that. We call it NPNCD, which is the National Program for Prevention and Control Non-Communicable Diseases, not only stroke and CVD and this. And this has been launched today in 610 districts of the country. Now, I just pass on to the what exactly possible the answer. One of the key programs under this is the establishment of the NCD clinics. Now, this NCD clinics was one of our objectives to establish these clinics, of course in JPEF and GA General Hospital, but across 15 health centers in the entire country. It was WDF funded, and I was the PI, and we had two co-PIs, Director General of Health Services, the DGHS from the state of Pondicherry, and our preventive medicine professor, Dr. Kumar. Now I'll just tell you what exactly we did. It was an initiative for establishing non-communicable disease clinics at the 17 centers, and Pondicherry is uniquely situated. The grant was given by WDF. They were impressed by one statement that we made. If you do anything in Pondicherry, you touch 5 states. Pondicherry, Karaikal you touch is in Tamil Nadu, Mahe is very much in this place in Kerala, and Yanam in Andhra Pradesh. So whatever we have done, the impact is felt at least in 4 states and 1 union territory. Now, what are the goals? To establish first a core advisory group, to set up the NCD clinics, to prepare the NCD care guideline and provide training. Now, dear friends, now the advisory committee included Union Health Secretary who came down. He is the chair of the JPEF, and we have the various people from the government of Pondicherry and also from the institute and from the primary health centers, and all these people were the part of the committees. Now, these are the community health centers. We established NCD clinics, and it was in the Karaikal, in the Mahe. It is still Mahe is one of the flagship project also in the Enam. And I'll just tell you what we did in this clinics. Very simple. Now, in these clinics, each center we visited, found out the state of the NCD in that particular PSC, and we tried to make the change. And this photograph of each center that we visited is now, it was 15 to start with, became 18 by the time we finished in the various parts. Now, these are the things we provided under the project. We fitted electronic PP apparatus, one in number, but they were made into 3. Electronic digital weight machine, stadiometer, portable single or double channel ECG with all the accessories, measuring tape. We give a manual for anthropometric measurements. We provided the registers, how to keep the data, and we gave NCD screening card. Now, dear friends, you will find that there's a lot of enthusiasm among the PSCs and community health CSCs to be part of this. That's why we have to increase from 15 to 18 at the end of the day. And you will find that in all the centers, they accepted these instruments and were committed to do the needful, for which training was provided. We also provided auto-analyzers, not to all the centers. We provided auto-analyzers to every 6 centers together. We gave totally 6 auto-analyzers and provided funding for transferring the sample for the test. Now, we have an NCD screening card, which you might have seen, little modified it from Government of India. We also did what are the activities done? Screening of the population of 30 and above who doesn't have any past history of DM or hypertension. Of course, known cases are taken care of. Measuring the demography, height, weight, waist circumference, BP, random blood sugar, registration of the people, suspected screening card has given to them, follow of the people detected newly diabetes, hypertension, all the cases already having. We provide counseling for the management of diabetes, hypertension, obesity, and also diet counseling. Now you will find these various stages of the work that is done here. There is no time to detail go for it, but the various measurements, BP measurement, blood sugar measurement, everything was done at the primary health centers, CSCs. We also did a lot of awareness programs. We celebrated the World Diabetes Day. We celebrated anything connected with the NCDs, World Hypertension Day, World Obesity Day, and did a lot of rallies and lot of public health campaigns and awareness campaigns in the health centers itself and also in the community, which was very popular. Now this continued, and we also celebrated, as I told you, World Heart Day and all the days connected, World Stroke Day. So remember, each of the days was used as a not to walk, but take a leap towards the future. Very helpful. And we had a lot of pamphlets. I'll not show it here, but they were very helpful. And we organized NCD exhibitions. It's a good concept of Mohan. Providing NCD exhibitions were fabulous. They came and went around the various places in the center or in the bigger hospital to take part in these exhibitions. So in various places we had this, and we had 2 focused teaching programs. One, we taught the training of the teachers. We got teachers participate in the awareness programs, and we brought out 2 manuals. One manual for the teachers and one manual for the healthcare providers, physician, non-physician. Physician, healthcare providers, a different manual, training manual, and the non-physician, like the paramedics, the sisters, the pharmacists, there is a different training program with a different manual. So this training program, 3 teachers, physicians, and non-physician health workers were very useful in providing that. And there were sensitization training programs. You can see that, and you will find that for the physician, the training program, details of how it was done, I will go into details of it. And you know, in all the programs, we had an inauguration to sensitize. You can see some of the programs also the minister came down to take part in the program. And dear friend, the talks were given by Dr. Kumar and many of us within the authorities themselves from Delhi. The non-physician training manual, which is focused here, and we had the various sessions if you are there. I don't know details of it. So I'll finish here by saying there were various brainstorming sessions with the school teachers at which standard we should include this to the student. The outcome project is not yet fully measured. It is targeted framework for screening. It has been complete. It's going on, and the data analysis interpretation was done in various centers. And I don't know details of it, but I will end by saying that we have found this project very helpful. We have got an additional grant now. The additional grant is to tone it up and take it forward. Dear friends, I'll end it here by saying that NCD can be tamed. What it needs is your sincerity, tenacity of purpose, and your passion to control NCD, tame NCDs. Thank you very much for your patient here.
Thank you very much, sir, for the excellent presentation, and it's the revelation that NCDs are a huge public health program rather than a curative thing. And I hope Ashok Kumar will definitely agree with me when I tell that the 90% of what we discuss here in these forums benefit only 10% of population, the well-known 10, 90, 10 divide or 10, 90 divide. And 90% of our population don't have access to even 10% of what we discuss here. So the initiatives like this has a huge impact. Even though our state has an NCD program, these NCD programs are even run by the government, they have their own pitfalls. But how to bring them up to at least a desirous level? Because a lot of public health initiatives like what Ashok Kumar has currently right now demonstrated here. I think the message is very clear, and every person, every physician here who is taking an one-to-one role in their clinics may also take a public health role to spread this message to the community, so that at least part of what is being discussed here is gets affordable to the large chunk of population outside our nets. Probably that's the message here. Thank you. Any questions?
I would like to say that the taking care of the NCD is paramount importance, and all of us who practice whatever branch of medicine have to devote time for this control. There are people who do not measure blood pressure. Morning I presented a paper in the abstract session that the control of blood pressure, even 5 years after diagnosis, mean was 155 systolic, mean was 105 diastolic. See the pattern, and the blood glucose control you know from the ISO India study. So therefore, it needs attention. And you know, it has been rightly said by the SDG goal that if you do not, it says the choice is imperative. I am telling the exact words of the World Health Assembly, the choice is imperative. You have to tame NCDs, prevent, otherwise we may perish. Thank you.
There are no comments. I will close this. Thank you.
Thank you so much, some speakers, for the wonderful session. Now we have the Keshav oration. Ladies and gentlemen, P. Keshav, born in 1904, revolutionized Malayalam literature by giving voice to the common people, peasants, beggars and farmers. Despite leaving formal education at 14, his writings and speeches passionately fought against social injustice and caste discrimination. Keshav's legacy as a powerful orator and prolific writer continues to inspire us. Now, it is my great honor to introduce Dr. Nihal Thomas, Senior Professor at the Department of Endocrinology, Christian Medical College, Bellu, for the Keshav oration.